Welcome to Bridging Healthcare with Bridget. Kindly subscribe, like, and follow this channel. Hit the bell so that anytime I make a post, you will be the first to know. Thank you.
Hello and welcome to Bridging Healthcare with Bridget. How are you doing? How has your career been? How has work been for those of us that are already healthcare assistants? And how is the preparation for those of us that are working on it? Thank you for always tuning into this channel. And if you've not subscribed, it's not too late. Join the tribe, click the bell button, subscribe, like, share to your friends. This is solid information that is for free. Okay? Today, we're going to be talking about something interesting, something exciting, something educative. Like you very well know, for this channel, all we do is talking about how to be a highly efficient and effective healthcare assistant. And healthcare assistants include nursing assistant, nursing aide, support worker, care worker, the occupational therapist, the different fields, social worker. Check my previous video. You will see where I listed all the different roles that can be found under the healthcare assistant opportunity. Now, you are already in the field. Today, I want to discuss something really interesting, and it's going to work for both of us, those of us that are still training to resume a job, those of us that are already on the job. It will help us to improve ourselves on the job. And it is nothing else but administration of medication for healthcare assistants. Administration of medication for healthcare assistants. It's important for a healthcare assistant to understand how the medication they're administering works. You're not the doctor, you're not the nurse, you're not the pharmacist, but because you're also involved in that process, if it's within your care plan, then it's a high prerogative for you to understand what the medication does, so that if there is a side effect, say for instance, and the patient is beginning to exhibit that particular side effect, and it's already told that it's going to wear out, then there's no need for you panicking. You also need to understand how the medication is absorbed and how it's excreted out of the body. The aim is just to understand, have a general foundational knowledge of what this medication does and how the outcome of the medication, the adverse effect, when you should ring emergency if there is an adverse effect, or the person is having an anaphylactic attack, which is caused by allergens. In another video, I'm going to talk about what allergens are and what they can do and how you can help somebody in that scenario. So now there's a rule of thumb. Remember, follow your care plan. It's number one. If you have been given a care plan, of course you must have been given a care plan. You must follow your care plan to the detail, and you must document. Those are my first two. Whatever you are doing, follow your care plan. Even if the client says, I know that they said you should give me 2, I want to take 3. You tell the client you were asked to take 2. So I'm not given that instruction to give you 3. If you want to take, this is the medication, it's your medication, but I will not give you 3. Do you understand? So it's always important to follow the care plan. Now, for some clients, you are not supposed to touch medication. They do their medication themselves, or family member does their medication for them. If family member does their medication for them, then leave it. They may just put in your care plan prompt. So if you are asked to prompt, what does it mean to prompt? It means that you remind the person it's time for your medication. Then most times the pharmacies package the medications already. If the person takes like 4 different tablets, the pharmacist package it already in a tablet tray, and it is sealed and it is dated, or there are days of the week there. There is Monday, there is I will put a picture of what this looks like on this video. You will see it somewhere around. So there is Monday, breakfast, midday, tea time, dinner time, bedtime. However, the person should take the medication. So if you're asked to prompt, your own is to bring the medication. Hello, let's say the person's name is John. Hello, John. It's time to take your medication. Are you ready to take your medication? If the person said they are ready to take their medication, if they use water or they use juice pop, whatever they use to take their medication, make sure it is available. Make sure that the environment is conducive enough for them to take medication. Don't let a bedpan should not be there. If you're looking at a bedpan, you won't be able to take medication or eat anything. So make sure that the bedpan is out of the way. If the person really needs to use the bathroom, let the person use the bathroom, and make sure that the medication is taken as at when due, and then you document. So you bring out the medication, you bring out, if you need to help the person open it, maybe their hands can, you help them open it, you put it in whatever they use to put their medication. They will now take the medication and use it. From my training, I don't take the medication and put in their mouth. The client will take the medication, except the client is not able, and it is indicated in the care plan that you give them the medication in their mouth. Sometimes they write in the care plan that you should watch the client take the pill, because some clients just hide it somewhere, and once you are not looking, they take it and they throw it away. So this happens majorly with water tablets, because they always have to go to the bathroom and stuff, so watch them take it or give them the water. Make sure that they take the medication, and then you put it away. Now, what happens if the client is declining? Now, remember that there's autonomy. The client has absolute control. If the client says, I do not want to take my medication, there are ways around it. You can always say, oh, John, okay, how are you feeling? Why don't you want to take your medication? Okay, you don't want to take it right now? All right, let's wait a bit. You see? So now, you have given the person an option to wait, that they will still take it, but they will not take it at that particular time. Now, if the person insists that they are not taking the medication, there are two things to do. If you can reach your supervisor, reach your supervisor. This client has declined taking medication. And then, I don't know how your company works or whatever the situation is. It's always an organized system. There is a MAR chart. There's what is called a MAR chart. I know of MAR charts in the United Kingdom. There's a MAR chart that you use to count the medication, and that's to tick the medication that was taken. Now, when the client declines, you will click on declined, because that medication will still be there. So you call your supervisor and you document to say this client refused taking medication or declined taking medication. And then you can take what steps. I tried to encourage, I reassured, but this client refused taking medication. Second thing you can do is, if the client has family members that are caring for them, that are really the one in charge of them, you can just call the family member. Maybe they will respond better to the family member. Hi, John has refused to take his medication. What can we do? That person can come and say, okay, John, it's time to take your medication. And before you know it, they might succumb to their family member, and then they take the medication. You also document, John refused taking medication. I reassured and encouraged. He didn't. I had to inform his daughter or his niece, and she came and she encouraged him, and he took the medication at so time. Now, this thing I'm about to say, very, very important. Please do not modify medication. If it's not within your care, it's not even allowed. They give a client a medication, and then you now say you want to grind it. Don't grind it. Don't modify medication. That's number one. Number two, don't cunningly make a client use a medication. Like, okay, this client has declined medication. They need it because you feel that they need the medication, because there are legal and professional responsibilities that are associated with taking medication. They are legal. and they can sue you if you break the law. So you are not allowed to modify the medication, because you can modify the medication, and because you're not the pharmacist and there's an error in it and the medication does something wrong to the client and the client maybe passes, you're going to be in trouble. So if there has to be a modification, let the client do the modification themselves. You're not to grind medication, you're not to dissolve, put it in something to make it different. No. Let them take the medication the way it ought to be taken. Also, number 2, don't forget, do not hide or use a cunning method to get a client to take a medication. Do not use a cunning method to get a client to take a medication. Why? Because you are deceiving the person. Like, you know how when we're young, you hide the medication in a food, or you say, oh, this person likes to take Coke, this medication is powdery, I can turn it in the Coke, and then he gets to take it. That can land you in jail. That can get you in trouble. Because that thing you are mixing the medication with, you don't know what it entails. You don't know if it interacts wrongly with the medication. Because medications, tablets, are combinations of chemicals. Now, when chemicals combine, if you're a student of chemistry, you know that you can add acid and base and it will form salt. So you don't know if the fluid you are mixing it with, even if it is water. Water is also a chemical combination of hydrogen and oxygen. So even water, you shouldn't do, it's not allowed. Don't hide medication. Let them use their medication. Let them know they are using their medication. You have to verbalize. John, it's time to take your tablet. This is your tablet. If they don't want to take it, they are seeing it and they totally refuse taking it. But not that you are now trying to get them to take it in some form of way or the other. Even if the person is suffering from dementia and is not capable, you are not allowed. Even if the person is in coma, you must still tell the person, it's time to take your medication. Yes. Even if the person is not awake, is not understanding what you're saying, you must still take that time to explain to the person it's time to use medication. You see, medication handling, it has led many people into trouble. And that is why I want you to take all these points seriously. Before you give any client any medication, even though if for instance the client's medication is only in a pack, it's advisable to read the pack. It's advisable to take out the leaflet inside and read. It will help you to know what the medication does, the allergen, what it can cause, what side effects can happen. That way, if the client maybe the medication side effect is that it makes them dizzy. So you want to give this client the medication. You remind them, I hope you're not going to be driving in another 2 hours, because you might not be there for that 2 hours, because this medication will make you drowsy. Or a medication is known to cause vomiting, which is a regular side effect of that medication. It does not mean anything. So before you give the medication, you should have a bowl, a vomit bowl, just around the corner, should that client vomit. I remember when I used to work in the hospital as a nurse, there is this particular injection. When somebody comes with some form of infection or sepsis, that medication, that antibiotics is very fantastic. It's called ceftriaxone. I don't know the name. I can't remember the name. But I know that that particular medication, when they give it as IV fluid, you give it through the veins and you rush it, the client most likely will vomit. So, having known that, I decided to dig further. So for that kind of medication, I had to go and study about it, and I realized that if you give slowly, you push slowly, and then you gently rub on the hands of the person while you are pushing the medication, the person most likely will not react. And that was it. You see why you need to study? You see why you need to understand. And so I hope this information has been useful to you. So as you journey in your healthcare career, always remember that every information must be documented. Nothing should be done outside the care plan. And when you're giving medication, do not modify. Do not hide the medication and give the client in a funny way that they will not know that they're using medication. And always inform the client before you do anything. Get their approval. Thank you so much for another time. I hope that this information is useful for you and it's going to make you a more effective healthcare assistant. I wish you all the best in your career and I hope that we'll talk again soon. Do have a pleasant one. Bye.